So you heard me tell you that Barbara's lying to you about how we do a pap smear, but you yourself still have bleeding every time you get a pap. So what's going on? The most common reason for bleeding after a pap smear is that the cervix is very delicate. So anytime it's brushed with a brush or anything else, it might have a little bit of bleeding, and this is normal and very common. Some people also have what's called an ectropion, where the inside cells of the cervix are a little bit on the outside, and that makes that tissue extra delicate, or what we call friable. So again, every time it's brushed, there's a little bit of bleeding. The next reason is that there's some kind of infection that can lead that tissue to be more sensitive when we brush against it. So if you have other concerns like an odor or new discharge or a new partner that you just want to make sure that everything's okay, very reasonable to talk to your doctor about getting swabs while they're doing your sterile speculum exam. And the next reason is the whole reason that we're doing the pap smear, and that is that cervical dysplasia, or abnormal cells and tissue of the cervix, can lead to the tissue being very sensitive when we brush against it. And so that's the whole reason that we're doing this test, is that we're trying to rule out those concerns. I personally like to tell my patients when I see a little bit of blood on the brush that I see a little bit of blood, this is not concerning to me, and that we should have answers within the next couple of weeks to make sure that their pap smear is normal. I'm so proud of all of you who are in the comments mentioning how they don't like going to get a pap smear or that they find it uncomfortable, but they understand the importance of testing for cervical cancer because, like I said, your body's not going to tell you if you have dysplasia.